Should I add a guest?
Yes.
Hi, everyone. So we'll be starting a live really soon. I'm trying to connect to Doctor. Just give me a second. Have patience, guys. One second. Can you call him? Invite to.
Hello.
Hi, Doctor. Hi. I've just added you on a live, so probably it'll be easy for you to add me.
Shriya sent you a request on
Instagram.
Yeah, on Instagram.
So I just go on to the Instagram and
Yeah. Well, sorry everyone. Hi, Mahesh, beautiful. Manoj says, Chalwalo, Chala Bangmi. Thank you, Manoj. My brother says hello. There's love from Bangladesh. Yes, doctor.
hi there.
Tell him to no. Tell him to put the
Doc,
phone.
can you put your phone like that so we can see
This
you?
way.
Yeah, perfect.
Yes.
Okay. Hi there.
Hi. Uh, thanks a lot. Thanks for your time.
Welcome.
Really appreciate it. And you must be really busy and tired, but thanks
Yes.
for coming out and doing this live for us. Well, the reason I wanted to do this is we did this last year as well. Like you were very kind with your time last year. I think right now the second wave. There are a lot of confusions and a lot of things people are not clear about. So I thought let's ask you,
Surely.
and maybe we can help some people. Even if we can help some people, I think it's good.
There is a
Uh,
lot of misinformation, so I think I'll try my best.
Thank you, thank you. The first question I wanted to ask is, this is the second wave, and how different it is from the first one.
Yes. I think the COVID pandemic has hit India big time. And the second wave, I would refer to this as a tsunami. It's not just a wave, it's a tsunami. It has
Right.
wreaked havoc across the country. So compared to the first wave, when a lot of elderly people were getting infected, the second wave, a lot of youngsters are getting infected. That's the first thing.
Yeah.
Second thing is the infectivity is quite high. So in the first wave, we would hear of someone somewhere getting the infection. So now entire families are getting infected in no time. They're presenting to the hospital. And thirdly, the severity is quite high compared to the first wave. And therefore, you're seeing this reflected in the number of deaths as well. And now hospitals are overwhelmed with patients, which was not there during the first wave. So these are the striking differences between the first and the second wave.
I remember the first time we did this live, we discussed this then as well because there's a lot of confusion about what are the symptoms really are. Because some of my friends they complained they just had stomach infection and they didn't think it was COVID, but it turned out it was. I have another friend who's really young and they really didn't think it was serious, and then he lost his life. He's only 39. He was like a big brother to me. My friends, he lost his mother, and they all said the symptoms were very mild. So, what are the symptoms that you think that you need to be really scared of when they happen?
So someone having cough, high fever, and breathlessness, sore throat, runny nose, and they could have severe headache or myalgia, loss of taste and loss of smell, diarrhea, vomiting. There could be a range of symptoms. People could be asymptomatic as well, but there could be a
Okay.
range of symptoms that develop between the second day of the infection and the 14th day. So these are the symptoms that one must be aware of, and any
Yeah.
symptoms uh, when someone has any symptoms which are usually unusual to them, they must immediately isolate themselves and get themselves tested.
Okay. Oh, but sometimes a lot of my friends were cured by themselves in like 2 days. And they had really high fever, but the second day it subsided and they were fine. So, but there's also that little fear, do they go to the hospital or not? Because of all I mean, medical staff is also overworked, and just to
Very
be
true.
there when you might not be that severe, one feel not fair to the other patients who are really serious.
Yes,
Um,
I think it's
so
very important not to panic
not
because
to
the
panic.
vast majority have just mild symptoms. 80%, that is 80 out of 100, will have just mild symptoms like, say, headache or self-limiting fever, and they don't need to go to the hospital, the vast majority.
Okay,
15% will have moderate disease that require admission to the hospital, oxygen, and also some medication. And 5% will be critically ill, requiring ICU support and ventilators. So the vast majority have mild symptoms. So the
okay,
first thing to do when someone has any of these symptoms which I've just outlined is to first of all isolate themselves because they need to protect their family, and then as soon as possible to get the RT-PCR test, which is a nasal swab, which is done and the result comes within 24 hours. And during that time, they must be isolated. And so
correct.
when the result comes, and if they do have just mild symptoms, they need to be at home. They need, first of all, as I mentioned, it's important not to panic, and the majority, 80%, can just be managed at home. They need to be isolated in a well ventilated room. They must have a separate washroom to themselves. They must wear a mask all the time, preferably a double mask, and
Okay,
they must have their own utensils. And all they need to do is to have a paracetamol available with them. So if they have fever, they just need to take paracetamol.
okay,
But the most important things for them to do is they must have a thermometer to check their temperature every 8 hours. They must have a pulse oximeter to check the oxygenation. So these are
okay,
the two important things. In addition, if someone is a diabetic, they must have a blood glucose monitor, which they must check once in 2 days. And the basic bloods that one must get done is a complete blood picture, a CRP, and a D dimer, which indicates the degree of inflammation. So
okay,
with these basic blood tests and with a pulse oximeter and a thermometer, one can manage at home. The vast majority of the times they can be managed at home, and that's a very important message to convey because as soon as they have symptoms, they should not rush to the hospital because they will
mm,
be burdening the already overwhelmed healthcare system.
yeah,
And it's
because
very
that's what
important.
happened.
Yeah. Yeah. And
Sorry.
also, when they have these symptoms, it's important to maintain a sheet where they have the symptoms documented on a daily basis so that they know,
Okay,
whether it's getting better. And also, it will help the doctor when they're explaining to the doctor. Say, if they have a temperature which is measured every eighth hourly, they can have a chart and say, okay, 8 a.m., 4 p.m., and then whatever time at night, the temperature is checked and whatever the temperature is recorded. Similarly, the oxygenation, the pulse oximeter, whatever it shows. And it's always a good practice every day to do what's called a 6 minute walk test. So once you take the baseline saturation reading with the pulse oximeter, you walk around the room for 6 minutes and then take the saturation, measure the saturation. If there is no
okay,
change, then they're perfectly fine. But if there is a
okay,
significant drop of more than 4 points or the oxygen saturation comes down under 94, then they must be contacting their doctor. But if their saturation is above 94 and is maintaining above 94 with the 6 minute walk test, then they're perfectly fine.
okay. Um, and and if you're getting breathless at home, like you just spoke about the walking test, and if you are, what is the first thing that you're supposed to do?
First and foremost, I'd
Especially
like to
someone. someone is elderly, I'm sorry, you feel you get more scared about them. There's a lot more fear right now. So how do
Yes.
what is the first thing that you should do
The first and
apart from that
foremost
list?
thing, yes, I'd like to emphasize again is not to panic, because by panicking, the breathlessness will get worse. We know
Sure.
that for a fact. So the first thing is not to panic. The person who is affected must be in a well ventilated room. And
Yeah.
I think one of the things to do whilst contacting the doctor is to keep the patient in the prone position. Prone position is lying on your belly, and
Okay.
that really significantly takes away the pressure on the lungs. It enhances the oxygenation in the lungs as well. So I think
Okay.
you need about 4 pillows. One pillow is placed under the chin, two
Okay.
pillows in the region of the pelvis, and one
Okay.
pillow at the level of the feet, the knee. And so that the patient is lying and there is a gap between the abdomen and the bed. They should not be putting pressure on their belly. They should be putting pressure on their chest. So it's important
Okay.
that when they lie prone, it significantly improves their oxygenation. So it's important not to panic, to keep the patient in the prone position, and try to shift the patient to the hospital as soon as possible.
Okay.
When someone is
Um,
getting breathless, when someone's saturation is falling by more than 4 points on the pulse oximeter, and if their saturation is persistently less than 92, then they must not delay.
must not delay. Okay. Um, and there's a lot of fear is again that especially if someone is older, you get really, really scared and I feel like youngsters are more scared about like I sitting in Barcelona, I'm every day really scared about my parents. It's just there's a lot of fear. But what is the food and what kind of when you? I mean, I hope everyone gets recovered and it's fine. But what is the food for recovery that one should stick to?
I think the food we eat determines our health, and it's very important, particularly at times like this, to take the right kind of food, low carbohydrate, high protein, but not red meat, chicken and fish, but green leafy vegetables and fresh fruits, particularly fruits which are rich in vitamin C. And it's important to, keep yourself well hydrated, and it's very, very important not to be dehydrated. So it's important to drink plenty of water, and it's important to move around in the room. It's important not to just stay stationary or lie down. Every now and then, every hour or so, it's important to get up and just move around. And also, alongside all these things, it's important also to calm your mind through meditation. There are several meditative techniques, and as someone who practices Isha Kriya, which just takes 12 minutes of your time, it can
Yeah.
be done. And also, there are certain yogic practices, particularly Simha Kriya is a yogic practice, which is quite a powerful yogic tool where someone inhales and exhales by keeping their tongue out and tongue inside.
Hmm.
So this is a procedure, this is a practice that can easily be learned. It just takes 5 minutes, and it's
Sure.
been proven in studies even from Harvard that it certainly increases the oxygenation in the lungs, improves the lung capacity, and also enhances one's immunity. So I think during this period, it's important to enhance one's immunity, to calm your mind, to keep mobile, eat right, and keep yourself well hydrated.
And do you give any import? I do. That's why I wanted to ask you. I feel like it's really important to up your immunity, and there are a lot of small little things that we have in Ayurveda. Just like there are a lot of things that you can do. Is there anything that's your favorite? I mean,
Nothing, I
breathing
think,
is like
yes,
I
breathing
challenge you.
exercise, yes. So I think I focus on, keeping myself active, eating
Correct.
right, and also practicing meditation and Isha Kriya every day. And I think it's
Yeah.
important to keep positive and to keep away from too much of television or WhatsApp, because negativity does have an impact on the mind. So it's important to keep away from negativity because there is so much of it around.
I mean, and I feel like whatever suits you, whatever suits works for you. Like for my mother, she does a lot of chanting. I also do
Yes.
chanting. I do Vipassana or Isha Yoga. I've done that also. It's beautiful.
Yes.
Breathing exercises I do. I believe in. I mean, we just whatever just to keep your immunity and emotionally happy and high. I think
Absolutely.
that's
Because
important.
a disease affects not just the body, but it also affects the mind. Just like cancer doesn't just affect the body, it affects the mind as well. So preparing the mind is as important as preparing the body. And if the mind is well prepared, then it's half the battle won.
Yeah, that's true. Um, uh, okay. Uh, there's another question that someone asked is that should we wear mask at home? But I feel like if you are infected, then you just keep yourself in an isolated place. But anything, do you think you should? You must wear a mask at home?
Yeah, if someone is infected, they must
So,
be in a well ventilated room, a separate room. And when someone, who's looking after that person must definitely wear a mask, preferably a double mask or an N95 mask, uh, and uh, and particularly when they are cleaning the utensils used by the person who is infected, they must wear a mask. And regardless of COVID infection, even at home, it is my personal advice to wear a mask when you're in common areas. So in your room, you don't need to wear a mask, but when you're in a common area, it's very important because you just don't know who has the
sure.
infection and who doesn't have the infection. And if you wear a mask when you're in a common area, you are minimizing the chance of everyone in the family getting infected. So it's very important, I think, particularly during this second wave, for
Yeah.
all of us to wear a mask when we are in common areas in the house.
Oh, I know you don't like to talk about it, but you're doing a very beautiful initiative about mask. I would like you to talk about it because I think if everyone's looking out for something to contribute to do, and it's a great initiative, and maybe people would like to contribute in this one about the mask initiative that you're doing, which is
Yes,
I think beautiful.
yes, of course, as all of us know, the COVID infection is rising at an alarming rate in the rural parts of our country in a big way. We don't have any statistics there. We have very little healthcare facilities. The healthcare infrastructure is not as robust as it is in cities. And I have adopted a village in Telangana, one of the remotest villages in Medak district called Ibrahimpur. It's a part of a mandal called Narayanrao Mandal, and there are 10 villages around. So it has been my endeavor to provide masks to all the residents in all these 10 villages. So we are providing these masks, and I would like to reach out to more villages. So any help is more than welcome, and I'm doing it through the Ushalakshmi Breast Cancer Foundation, a foundation which I established in my mother's name, who survived breast cancer. So we're also having these pink masks made because pink also represents breast cancer awareness. So a lot of cancer patients are not presenting; they're delaying their diagnosis. So this is also to raise awareness and create awareness about the importance of early detection as well as protecting themselves. Because in rural India, if you're able to get people to wear their masks, it's one of the most important pillars of preventing infection. And sadly, many people are not wearing their masks in rural India because they're not aware about it and they don't think it's important. So it's important to create that awareness, particularly at this moment in time, because the infection is really at a very alarming rate. It's rising in rural parts of our country.
Yeah, and I think it's better to just be careful than sorry later. And
Absolutely.
the next question is is the most talked about. Is about remdesivir, and everyone's talking about it and save life. Can it be given at home? I think that's one point that I would really like you to talk about.
Yes, it is an important point, and remdesivir is on everyone's lips, but unfortunately, it's not a magic bullet.
It's
It's
not.
not some, yes, it's not, and it's not something that must be given at home. This is an injection, this is a broad spectrum antiviral injection that is given in the hospital setting as determined by the doctor during the initial phases of the infection. That is within the first 7 days when someone's oxygen requirements are low, that is, their saturation is low on room air, it's less than 94, and they're requiring oxygen, or they have persistent fever for more than 4 days, or there are other markers of inflammation which are rising earlier on in the disease. It is given during, not after 7 or 8 days, but it's given during the first few days, and it's a 5-day injection course. And what is important
Yeah.
is that several studies have shown, and it has been established, that it does not lower the mortality. It
Okay.
definitely does not improve the survival. It certainly probably, it just probably shortens the hospital stay and makes recovery a little bit quicker than normal. But actually, the World Health Organization has not recommended that this drug is used at all. But certainly, this drug has a limited role. But it's important for people to understand that this is not a drug that is taken at home. This is not a drug to be purchased and hoarded at home so that it's not available to people who really, really require it. So it's something that we must understand, that it's not a magical drug. It doesn't save lives. It just helps in, fastening the recovery in certain individuals, and it must only be given on the prescription of a doctor in the hospital setting.
Okay. So don't try giving it at home.
No, no, not at all.
Okay. And what about
And,
plasma
and
therapy?
please don't buy remdesivir and make it not available to people who really require it. And people are buying it in black market and things like that. This is something that should not happen.
Okay. And what about plasma therapy, and when is it to be given? When should it be given? Sorry.
Yeah, plasma therapy also is not a magic bullet. It has also been overrated very much because there's a very recent robust trial which has just emanated from the United Kingdom. It's called the Recovery Trial. It is a randomized trial to test the efficacy of plasma transfusion. And they have involved 177 National Health Center hospitals, NHS, National Health Service hospitals, and there are about 11,000 patients who have been enrolled and have been followed up for several months. And this trial has very clearly shown that plasma therapy does not improve survival and it does
Doesn't.
not change much. But again, like remdesivir, plasma therapy is basically taking plasma from somebody who has recovered from COVID and who has the antibodies against the COVID virus. And if it is given, say from day 28 to day 60 after they have recovered, if it is taken, then, it can be effective in a small segment of people, again, during the first 7 days of the infection. And once again, when the oxygen saturations are coming down, and as determined by the doctor, this plasma therapy can be given, but in selected patients. But it should not be given, just like that willy-nilly after 7 days. And we must also understand that plasma therapy is not a magic bullet. It does not save lives. It does not improve the survival rate, but it just probably helps in recovery. But again, there is no established evidence to that effect. And I've just quoted about one of the largest trials which has been done in the UK, which has not shown that it is beneficial.
And steroids? What about steroids?
Yes, I think steroids are again very dangerous. I would use the word very dangerous because they can cause a lot of havoc, and they can also induce, it can also lead to death of the patient if it is taken very early on. And
Okay.
steroids must never be taken at home. They must never be taken without doctor's supervision, because in the first few days after the infection, the virus is in a replicating phase, or rather, virus is multiplying. At that time, if steroids are taken, the immunity gets suppressed. When the immunity gets suppressed, the virus replicates even faster and can make the virus, which probably was not life-threatening initially, to become life-threatening. So therefore, steroids must never be taken in the first few days after the infection. It is only given on strict supervision of the doctor in the hospital after 7 days when someone is developing moderate infection or progressing to severe infection. It has absolutely no role in mild infection. So steroids must be carefully used. And also, we have recently been reading about the black fungus or the
Yeah.
mucormycosis. And
My
one of the
sister told
reasons
me
for
about that.
getting, yes, one of the reasons why people are getting this black fungus or mucormycosis, which is a very life-threatening fungal infection, which occurs after people who have recovered from COVID infection. One of the reasons is people taking steroids inappropriately or taking steroids over a prolonged period of time against medical advice. So I think it's very important that we don't misuse steroids and we don't take steroids without doctor's prescription, and that too should be given only in the hospital, and that too not earlier on. It should be given later on in the disease course when patient is developing moderate to severe disease. That's when the lungs get affected, during later on 7 to 14 days, when patients become hypoxic, that is their oxygenation is less. That is when the steroids help to resolve, and not when the virus is replicating during the early phases of the infection.
Another question is antibiotics. Are they useful in COVID?
Certainly not. COVID is a viral infection. Antibiotics work against bacterial infection. So straight away, taking medication like like doxycycline is of no use. Yes, antibiotics are used in the hospital setting by the physicians when to prevent secondary bacterial infection. So in certain indications, they do give antibiotics, but as a routine, although we have been seeing in the media and also a lot of people are being prescribed with doxycycline, which is an antibiotic, and also ivermectin, which is an
Yeah.
antiparasite infection, which is again also being used in mild disease. It has absolutely no role, in treating COVID, and there's absolutely no evidence to taking either doxycycline or ivermectin.
Okay. And heart-related problems from COVID, is it possible to have
Yes,
anything?
heart-related problems do occur, and it has been quoted to somewhere between 15 to 20% of
Okay.
patients who develop COVID infection can have COVID infecting the heart. It can be of two ways. One is people who already have pre-existing heart ailments,
Okay.
and the other is COVID affecting the heart without having any previous heart ailment. So because COVID is an inflammatory disease, it causes inflammation throughout the body. It causes inflammation in the lung, and so
Mhm.
it can cause inflammation in the heart, which is called myocarditis. And
Okay.
heart infection can occur, or heart involvement can occur a few days after recovery as well. And so people must be aware that if they develop chest pain or discomfort in the chest or breathlessness or palpitations or an increased heart rate which is persisting, they must not ignore and they must consult a cardiologist.
Um, Andre? So I have to interrupt because he's asked me to ask you two questions, and so it's better
Sure.
that I just call him and ask.
Yeah.
Because apparently he read these questions in.
Yeah, many people are asking. Hello.
Hi there.
Hi, doctor. Thank you for coming. Many people are asking about post-COVID general medicines.
And the question.
What medicines to take, during
Yeah.
post-COVID. I think, as I mentioned to you, the vast majority, 80%, have mild self-limiting infection, and the only medication that one needs is just a paracetamol, which is a paracetamol tablet, 650 milligrams, which is taken if someone has temperature or body pain. By and large, as I mentioned to you, taking antibiotics like doxycycline or ivermectin is not required. It's important to take the best medicine is to keep yourself well hydrated, to eat the right kind of food. So there's no need to take any other medication other than Dolo 650, which is paracetamol. So there's absolutely no need to stock your home with medications unless someone is already taking medications. It's very important that they continue with whatever medications they're taking, because many a times we see that people stop taking their medication. So if someone is a diabetic, they must continue to take their medication. And it's very important to keep diabetes in control, because uncontrolled diabetes can precipitate, can lead to complications relating to COVID. So these people are more prone to developing complications. So if someone has hypertension or high BP, they must be taking their tablets regularly. So it's important not to stop your regular medication. And if you're running out of them, those are the medications that you need to buy and keep. But for COVID per se, there's nothing else except paracetamol.
In fact, we were actually
For a mild disease.
we were actually talking about his mother, and a lot of parents, a lot of people are worried about their parents because they might have some other ailment. Like another question that I wanted to ask about was about kidney problems, or maybe you have BP issues, or like you said about diabetes. Should they take the vaccine, and how careful they should be about the. I mean, everyone should be careful, but should they be more careful about not getting the virus?
Absolutely. So if someone has kidney ailments, if someone is on dialysis, or someone has undergone transplant, these are people who can develop very serious, life-threatening COVID infection. So it's very important that people who have kidney ailments must take the vaccine as soon as possible. Similarly, people who have a heart disease, when they get COVID, it can lead to very serious life-threatening complications. So to minimize the effect of the COVID on the body, the best weapon is to get vaccinated. By getting vaccinated, although we may not be able to prevent the infection, but we can minimize the significant impact or the serious nature of this COVID, and also reduce the mortality to a large extent. So definitely they must be vaccinated on priority.
But like that's what we're discussing with Andre, because a lot of people feel, remember we were talking about it, that low immunity, if you have low immunity, you should not, maybe not take the vaccine. And that's a huge question.
I think someone whose immunity is suppressed, they are the people. For example, cancer patients, we routinely recommend all cancer patients to take the vaccine. So when someone is, say, going to have surgery, I do a lot of breast surgery. So before surgery, we make sure that, patients are counseled and they take the vaccine at least 2 weeks before the surgery. And when someone is having chemotherapy suppresses the immunity. So we ideally recommend patients to take the chemotherapy the vaccine at least 2 weeks prior to commencing chemotherapy. And if someone has already commenced chemotherapy, it's important not to take the vaccine during the chemotherapy, but during the interval. There is usually an interval of about 3 weeks. So it is during that interval that someone should be vaccinated. So all these people are immunosuppressed. So when the immunity is suppressed, the infection spreads faster and the infection becomes more serious and life-threatening. So anyone who is immunocompromised or is likely to be immunocompromised because of administering chemotherapy must take the vaccine.
Thank you.
Yeah.
Okay.
I have to go, sorry.
Okay, take care.
Thank you for addressing those questions. So we spoke about cancer patients. And okay, so the other question is, there's a lot of fear about, can you conceive, for a lot of people who are trying to plan a family, or for pregnant women, how dangerous it is, because one of Andra's really good friend from college. She was going to deliver, and she got COVID. This was last year, and we were very scared. Touch wood, everything was fine, but there's a huge fear about it. Um,
Yes. So
can
I
you?
think, can someone conceive during COVID? I think they can. But what
Okay.
is important is that pregnant women, because of the changes in their physiology, changes in their immunity, if they were to contract COVID, then they can potentially develop very serious infection. So
Okay.
if someone is considering to conceive, I think it's important to consider whether they can delay it. But when someone is already pregnant, they must be very careful. They must take all the protection measures that, the three pillars of support, wearing a double mask all the time, and physical social distancing, and also, hand hygiene. So it's very important to also stay indoors as much as possible, because when someone is pregnant, it's very important to
Yeah.
possibly prevent getting infected, because if they're infected, their chances of developing, even premature birth also is quite high, and also they can develop serious complications. So it's advisable to be very careful during pregnancy.
And but if in his friend's case, Andre's friend's case, the child was not affected. Is that how it is, or is she was
Yes.
just a lucky person, or
No,
that's
there
how?
is no evidence that the child will be affected or the fetus gets affected, and there is no evidence that the pregnant women should have a cesarean section. So there is no evidence that that really is beneficial, and the doctor must decide based upon the indications, specific indications for that particular individual. But it's important to decide before conceiving whether this is the right time. But if someone is already pregnant and they can't avoid it, they must be absolutely careful, because in pregnant women, as I mentioned to you, the chances of developing serious infection is quite possible.
And God forbid if it ever happens to anyone. I mean, if you have COVID and you have a child, I mean, you should maintain distance for a while, right? I mean,
I think when someone is newly born, according to the World Health Organization recommendations, there is no need to stay away from the baby. The skin to
yeah.
skin contact can be maintained, but it's important for the mother to wear mask. It's very important for the for the surfaces where the baby is kept to be very clean. And it's important to maintain distance, a little bit of distance, but breastfeeding can be done just after delivery, and taking care that the mother is wearing a mask. But there is no need to separate the baby from the mother.
Oh, that's at least the good news. And after vaccination, can you conceive, or you should avoid, like you said, seriously think about it for the next 2 years, because a
No,
lot
I
of
think one can conceive, and vaccination can be given during pregnancy.
Oh, lovely. Okay, that's you already, yeah. And what is the difference between the first dose and second dose of vaccine?
So all the traditional vaccines have two doses. The first dose, when it is given, the immunity kicks off in about 14 days to 21 days and lasts about 8 to 10 weeks only. So if someone takes just one dose of vaccine, it does not confer immunity in a long term. It's only a very short term. So therefore, it's very important to take the second dose as well, so that the immunity will be of a longer duration and it will be stronger. So just taking one dose will not do anybody any favor. So it's very important to take both the doses.
Okay. My friend Dhruti, she's a very dear friend of mine. She wished you best of luck for your foundation.
Thank you.
Um,
Thank you.
and someone asked about Mr. Neil, sorry, about post-COVID measures that you should take. You want to address it now or towards the end?
Post-COVID measures, meaning, I think everyone, who has been infected with COVID still must continue to maintain the three pillars of prevention. That is, they must wear a mask, because they can get infected.
Again.
And yes, they can get infected again because that can happen. And also, it's important to maintain physical distance, and it's important to keep yourself hand hygiene, because we are in a COVID era, and this is a war that we are fighting against the invisible enemy. And it's very important to be cautious all the time, whether or not one has got vaccinated, whether or not one has already got the infection, because the infection can come again because of various reasons. So it's very important that we as a nation are very responsible at this time.
You already addressed this question, but someone asked this as well. Is that after vaccination, can one get the infection again? You said yes, you can.
Yes, that's
uh,
called something called a breakthrough infection. So even after
okay.
vaccination, one can get infection, and it can occur because of various reasons. They can develop the infection whilst, in fact, developing the immunity to the vaccine. If they're exposed to somebody who has the COVID infection whilst they are developing immunity, they can get it. And there is a lot of variants which we are seeing now, whether it is the UK variant, the Brazilian variant, South African variant, and this B1617, which is a variant of global concern, although it has been seen a lot in India. So because of all these variants, the vaccine may not be effective. And also we must remember that no vaccine is 100% protective. It has, all these vaccines are about 70 to 80% protective. So there is always few people whom they will not mount the necessary immune response. So it's very important to be careful even after getting vaccinated.
And can the mutational virus overpower the efficiency of vaccine? Because, like you just mentioned, this is a mutated version coming from different
Yeah,
parts
so
of
I
the world.
think currently there is no evidence to suggest that mutations or the mutations within the virus will overpower the vaccine effect. It may reduce the effect of the vaccine. So if the vaccine is, say, 70% effective, it might become 60% effective or 50% effective. But I don't think there is any evidence to suggest that it will overpower the vaccine. The vaccine, as I mentioned again, is our only weapon against this virus. So I think it's very important that we take it seriously and don't miss the opportunity to get the vaccine whenever you have an opportunity. So it's very important to take it as soon as possible, and as many people as possible taking it is the only way that we can overcome this pandemic soon.
And is it true that because it's a mutated virus, it's spreading really fast? And well, also, what is the possibility of third wave? Hopefully, it never doesn't come. But if at all, what are the preventions, and what are your views on it? Because there's a lot of fear about it. The
Yes.
third wave.
So basically, the question relating to the infectivity, as I mentioned earlier, the various variants, particularly the UK variant, has been shown to be 50 times more infective than the original virus that we have seen. So similarly, the B1617, which actually has been seen a lot in India and has been mislabeled as an Indian variant. It's not called an Indian variant. It's called a variant of global concern now, because this is spread across the world. So this is quite infective. Similarly, you have the Brazilian variant and the South African variant. So because there are so many variants and the virus is mutating all the time, it's trying to find a new host, and it's trying to find a way to survive. And that is why the infectivity is certainly, in the second wave, we are seeing a lot of infectivity. And one of the main reasons is because of the mutation in the virus. And with regards to third wave, I think it's all a big question mark. In general, if you see the effect of the third wave will really depend upon our vaccination strategy, our vaccination implementation, and the duration to which the vaccines will really confer the immunity, and the kind of variations within the virus which will make it more infective or less infective. If you see the track record of previous pandemics, what we have seen is that there's not just one wave or two waves. Usually there are multiple waves, And during these multiple waves, the virus tends to become weak, and over a period of time, the virus wanes off and the pandemic gets settled. So really, the question of third wave, I think definitely, I think it has been shown, and it's, I think, also been predicted by scientific experts that it is inevitable. But I think the impact of the third wave, how impactful it is, it's all within us. I think if we have a very good vaccination strategy and implementation, if we are able to do it quickly, then I think we can minimize the effects of the third wave. But on the other hand, if we are not, the vaccination is not able to get on top of the current infection rate, then we are heading for trouble.
Okay. This is a question which basically a lot of people I know who got COVID this time, and they're confused when should they take their vaccination, after a duration of a certain time or immediately. So that's something a lot of people are confused about. When do you
Yes.
think, Dr. Rishi?
So I think there has been some confusion very recently relating to the Covishield vaccine because there is evidence that has emerged, which has been published in the Lancet, which has shown that the efficacy of the vaccine or the immunity conferred by the vaccine will be much better if the second dose is taken between the 12th to the 16th week, as opposed to the original schedule of 4 to 6 weeks. But with Covaxin, there are only two at the moment available. With Covaxin, it is 4 weeks. The second dose, the interval between the first and the second dose is 4 weeks. There's no ambiguity. With Covishield, yes, the longer the time interval, the efficacy is better. It also suits us now because we have a shortage of vaccine. So this will allow a large number of people to get the first dose and then by which time the others are getting ready for their second dose. So I think it's important not to miss the second dose. It's important to take the second dose of Covishield definitely by the third month, not later than that.
Okay. And like my parents got it and they were comfortable with it. Everything, they, they didn't feel any fever, nothing. But if you do feel a week after your first dose, is that normal? Because a lot of people I
Yes,
know have that problem.
yes, many people do have minimal side effects. Some people do have fever. Some people have, headaches. Some people have myalgia. Some people have pain at the site of the injection. So these are all very normal reactions to the vaccination. Nothing to be alarmed about. The vast majority of people will not have any life-threatening, problems relating to the vaccination. And vaccination, as I mentioned again and again, is our only weapon against this invisible enemy. So I think we should not hesitate to take the vaccine because of the side effects.
I'm trying to read if there are any messages, any question that we should take. If you guys have any question, we basically ask whatever we think was important. If you guys have any questions, please let us know. I actually have someone who got COVID after their first dose of vaccination.
Yes,
Which is a
they
mistake a
can
lot of
get.
people do. They get carried
Yes,
away that they're vaccinated and they're fine, but they're not really. You just have to
absolutely.
wait.
There are two reasons why someone can get infected. Genuinely, they can get infected between the first dose and second dose if they are exposed to somebody who has COVID infection and they're not taking adequate precautions before the immunity develops. Then they can get it. And also those who skip the second dose, thinking that the first dose will confer immunity, then those people will certainly be at a very high risk of developing infection. So it's very
And
important to take both the doses.
after the first dose, it's not that you're really uh, protected. I mean, you might get really bad symptoms and you might get really bad COVID,
Well,
right?
after the first dose, you're certainly not protected, and
Yeah.
the protection only starts from about 14 to 21 days after the first dose. But the important fact is that the immunity from the first dose lasts for about just 8 to 10 weeks and not beyond that. So
Okay.
beyond that, you've lost the opportunity. And if you have taken the first dose, it's always important to take the second dose so that that immunity is strengthened for a longer period of time and protects you from developing life-threatening infection. So people who have taken the vaccine, both the doses of the vaccine, and if they were to develop COVID infection, their chance of developing life-threatening infection is significantly reduced. So their chance of hospitalization, their chance of dying from the virus is significantly reduced with the vaccination.
Can someone asked me, one second. Someone asked me if they could use, I'm trying to get their name. Someone asked me, can they use painkillers? I am Durgesh. Asked me if they could use painkillers after the first dose. Maybe they just care about what medicines they can put in their body.
Yes.
Because we get carried away and just take painkillers just like that. So
Yeah, it's important not to panic. It's important not to pop in painkillers just for the sake as a preventive or a prophylactic reason. But yes, if someone takes a vaccine and they develop fever or they develop myalgia or they have pain at the site of injection, they need not suffer. They can take a paracetamol or two, if it's required, but not as a prophylaxis. So soon after vaccination, they don't need to go home and then take a paracetamol or a painkiller. It should only be taken if there is a real indication or a need.
someone
And they must
asked me,
understand it's normal. It can be normal. People do develop fever. So it's
sure.
important not to get worried.
Someone asked me that if they took the vaccine and then they got COVID, do they have to repeat the whole dose again, or do they take the second
No,
dose directly?
no,
What do what?
if someone has taken both the doses of vaccine and has developed COVID infection, as I said to you, earlier, the infection will be mild or moderate. So the COVID vaccine, provided there was enough time for the immunity to develop, their possibility of developing life-threatening infection will be significantly reduced. But certainly, they don't need to take another vaccine because COVID infection is as good as getting vaccinated and conferring a longer-term immunity. Say if someone was to get COVID infection after the first dose. So now the recommendation from the government of India, Ministry of Health, is that they can even postpone their second dose for up to 6 months. So that means the COVID infection would confer immunity for a longer period of time compared with the just taking the vaccine. So if someone has had one dose, then they develop COVID infection, then the second dose they can delay it up to 6 months, but not long, but not later than that.
So Neil asked me, do we need CT scan? I don't think to. Oh, one
Well,
second.
yeah, this is a point we didn't touch about. When there is when COVID diagnosis is made through the RT-PCR, but when RT-PCR is not available, or even if it is available, CT scan is recommended by doctors. It should not be decided by the patient whether or not to get a CT scan. You should leave it to the doctor's wisdom to decide whether or not the patient requires a CT scan. A CT scan can be diagnostic. It will tell whether there is a probability of infection. It will also assess the severity of the infection depending upon the extent of the lung involvement. So a CT scan gives two answers. One is the chance or the whether there is COVID infection in the lung or not, and also it tells the severity. But it need not be prescribed in mild cases. That is, those patients, the 80% of patients who develop COVID have mild symptoms who can be managed at home. They really don't need a CT scan. So they can be spared of the need to just go into the hospital and getting a CT scan in an already overwhelmed healthcare infrastructure system where CT scans are being done day in and day out. I think we should spare the CT scans only for those who have moderate disease and, of course, severe disease. By and large, we should avoid getting CT scan done for mild disease.
Uh, Again, Shruti is asking this question, which is like, it's thing that we all take vitamin C. I take spirulina, vitamin C. I take a lot of supplements. Uh, and then in Ayurveda, there's Selfie Vatika and Giloy Vatika, which is very, very helpful for just increasing your immunity. Is are they? I know you'll say well, most important thing is prevention. But do these things also help in
Yeah.
creating a kind of immunity?
Yeah,
Are
no
they
harm,
helpful?
no harm. No harm in taking vitamin C, but the best source of vitamin C is fresh fruits, which are rich in vitamin C, like oranges. So I think if you can supplement it with fruits and
Okay.
food, which contains minerals and vitamins and green leafy vegetables to enhance your immunity, rather than popping in pills, it would be much better. But taking these pills will not cause you any harm, but certainly they don't prevent a life-threatening infection. So they don't have any impact, and many studies have shown that they don't have an impact regularly taking zinc or vitamin C. But taking
Uh,
vitamin C and zinc through your food is the best way to keep yourself healthy.
uh, Banu Priya, no, Sylvia Sushmita, I think, yeah. She's asking me, for pregnant mothers who are infected with COVID, when they take antibiotics, are an infant prone to teratogenic effects, which is a good question though.
Yeah, so in pregnant women, one must be very careful with regards to any medication they take because they must not willy-nilly be popping in pills. And particularly, even when they get infection, they must take antibiotics on careful supervision or on prescription of a doctor, and also those antibiotics that do not harm the fetus. And particularly during COVID infection, as I mentioned to you, in mild infection, there is absolutely no role for antibiotics. So there is absolutely no need to take antibiotics in the 80% of people. And in those patients who require treatment, it is anyway administered in the hospital by the doctors who will look after that.
Someone asked me that this time, a lot of younger generations, younger people are getting infected. So, like a friend of mine who lost his life, I was shattered for almost for a long time. He's 39. I know people who are as early as 20 are getting infected. Um, and is there certain kind of prevention that we can do for kids? Are they also? I mean, of course, they need to be careful, but is this mutated version more dangerous for children?
Well, the first wave affected the older population. The
Yes.
second wave is infected the younger population. And what is being predicted by scientists is that the third wave will infect children because the virus needs a host. And children have not been infected so far. And they are, very vulnerable in the third wave. And really, we must ramp up our hospital facilities, our pediatric ICU facilities in preparation for the third wave because the third wave is something that is very likely to infect even younger people and particularly children.
I know you've already advised this, but someone said that his mother is going through a neurosurgery and she should get COVID. You already said that, but maybe because someone
Vaccination
asked
is
that
important. Yeah. So I think
vaccination would be
vaccination
important.
is, yeah, absolutely essential for anybody. And, one should not defer it.
I think we've touched every question. Some Miss Vasan 2210 says, Doctor, you're saving many lives. You're a god for us. I think that's really cute.
Yeah.
I wanted to take
I'm
it.
not, I'm not, I'm not. I think on this occasion, we must pay tribute to the frontline healthcare workers, people really in the front line who are working in ICUs, who are, I think, putting their lives at risk their families' lives at risk, and they've been working day in and day out for more than a year. I think it is to them that we all should pay tribute, because the work that they do, the circumstances when they work with no rest at all, wearing the
Yeah.
full PPE is a nightmare. And I think we all should be very, very grateful to them. And we should try our best not to overwhelm the hospitals and the already existing infrastructure. And as I mentioned to you, once again, 80% have mild symptoms. They don't need to go to the hospital, and they must not overwhelm the already overwhelmed healthcare infrastructure.
Yeah, I think that's important. At, at these times, doctors, everyone who's worked on the front line, we have to be really thankful. And they saved their lives. I mean, uh, but still, I feel there's a lot of fear, and there's a lot of fear about what happens to people who get COVID, because I have a friend who's from America and they got COVID, and they haven't been able to get back to their sleeping pattern. And there's someone I know in America, they got COVID, and their smelling sense hasn't come back.
Takes
So
time. Yeah.
she was apparently she literally burned her dinner, but she didn't know it was burning because she couldn't smell it. Um, or heart infections or problems like that. Do you think these are serious issues? I'm not trying to scare
Well,
people. I'm just saying this is
no.
why you need to be more careful
Yeah, as
because
one of the symptoms is loss of smell and loss of taste, which an increasing number of people during the second wave have experienced. And I think time only will really help resolve this. So it usually gets better over a period of time, usually about 2 to 3 weeks, not longer. But some people have it for perhaps a little longer time. But all of this is self-limiting in the vast majority of people. So there's no need to be worried or panic about it.
I don't know if I should ask you this, but Subra Mishra is asking, is any vaccine your favorite? I know your answer,
No.
but because someone asked me.
Uh,
Basically,
in
what he's
fact,
asking is
yeah. So I
literally
think
he's asking which is a better
it's
vaccine to go for.
yeah, it's a good question. First of all, we don't have a choice, so there's no point thinking about it. And secondly, and most importantly, the people behind making all these vaccines, they spend hours and days, weeks, and months to bring something which normally would have taken many years for this vaccine to come. We must not forget that all the manufacturers of the vaccine, they have spent a lot of money, they've spent a lot of their energy, and most importantly, their time in developing these vaccines at record time. And all of these vaccines have been shown to be effective 70% upwards. So I think we should really respect what we have been given. We are very fortunate to have so many vaccines available. We have 2 vaccines, and we are now getting the third vaccine, Sputnik, which also will be available to people. And I think whatever vaccine is being administered in that center, let's go for it. I distinctly remember many people deferred taking their vaccines, thinking that a better vaccine will come. I know many people, and they actually missed the bus. And also now with this vaccine, we don't have enough vaccines available in every center now. So they've missed out, and a lot of people are regretting that they should have taken the vaccine earlier. So I think waiting for a better vaccine is not the answer. Getting vaccinated is the answer at the moment, whatever is available, because all of them are equally good.
Um, I thought this was going to be a very quick half an hour, but people are asking questions and I want to take them up. This is, I think, the last one is, Gidhari Krishnan is asking, does steam inhalation uh, help? I wanted to take it up because I have sinus and I take steam. And I think what he's trying to ask is Ayurvedic medicines, do they help? We've already spoken about it though, that of
No
course you
harm,
can't
no harm
do
in, yeah,
no
no harm
harm.
in taking, no harm in taking. Even, as somebody dealing with treating patients with breast cancer day in and day out, a lot of times people come up and say that we are taking alternative therapy like homeopathy or Ayurvedic treatment. Many times, they're rubbish, saying that, oh no, this won't work. But I don't rubbish them. I say that as long as they're going to be taking the allopathic treatment, if they take the Ayurvedic treatment in addition to the allopathic standardized treatment that is given, I have no problems, because it's important not to disrupt someone's mind when they feel that something will work. I think we
Yeah.
should allow them that liberty and freedom to take what they feel is right. But at the same time, they must understand that there is science behind allopathic medication. And if there is a medication that is prescribed, they must really take it. But if they wish to take also Ayurvedic and homeopathic treatment, I have no issues with that. And I think we should encourage that. If I do that, I do that, actively encourage patients presenting to me for cancer treatment. And the same holds good here as well. So if they are taking or they wish to take alternative therapies, no problem. With regards to steam inhalation, yes, it helps. And also
It does?
warm water gargling, yes, it does help. It keeps your airways free, and there's no harm in taking steam inhalation. In fact,
Because
it's a
that's
good
something
practice.
I believe in and it's really helped me.
Yes,
And it's also a very important part of Ayurveda. Um,
absolutely.
I can go on.
Hmm.
I think the Instagram will throw us out, but
Yes.
some people are asking some really important questions. Um, Doctor, you've been you're so I mean you are so respected and you're a Padma Shri awardee. There's so much that you've helped so many lives and you've touched so many people with your work, and we're so grateful to you to take time out for doing this. Um, but with all these years of experience, I bet this is like one of the toughest times that we all are going through and you're going through. We're very grateful for the mask initiative that you've done. Is there anything else that you would want to say, or any other initiative that has touched your heart that you want
No,
to
I
talk about?
think thank you very much for having me on Instagram. And first of all, I'd like to say that I believe in providence, and the Lord placed me at the right time, at the right place. And my mother's illness in the form of breast cancer has made me come back from the UK to India to serve my mother and my motherland. So I think I've been very fortunate to be having an opportunity to make a meaningful difference to the delivery of breast health care in a country that I was born and raised. And if there is one message I'd like to convey to your viewers, and that is that we must be nationalist in our mission to get rid of this pandemic. I think we must, whether there is a lockdown, whether there is no lockdown, unless there is an absolute necessity, let us remain at home. And that is the best way to preventing ourselves from getting infected and also infecting others. If we can achieve this, this will be the biggest contribution that we would have made to our country. I think this is what we should really be aiming to do, in addition to getting vaccinated as soon as possible. And let's hope and pray. And also, I always believe that, how well we behave or as a nation will really determine the effect of the pandemic in our nation. And let's hope and pray that we get rid of the pandemic as soon as possible. Thank you very much.
Thank you, Doctor. Thank you for your time. Very grateful to you. And yeah, I'll be coming back to India very soon.
Good.
Thank
All
you,
the
thank
best.
you, thank you, thank you.
All the very best. Bye.
Bye. Okay. Bye, guys. It was lovely talking to you all, and this is it. This is where we say bye to each other. This is the part I'm confused about. How do I sign out?
You don't know how to sign up?
Okay, I think I just say this, right?
Yeah, cancel. Finish.
Okay. My sister-in-law says frontline workers are doing the best. Aarti, sister from another mother. Okay, lots of love to you all. Thank you guys for watching. I love you all. And I'm gonna end this video.